Hello, my name is Marlon Charles. I'm a family nurse practitioner student at Harding University. Today we're going to be doing the neurological and the musculoskeletal systems. I'm going to stand over here and wash my hands. Have my patient introduce yourself, please.
I'm Lisa Charles.
All right, Ms. Charles. So the first thing we're going to do is start by checking the cranial nerves 1 through 12. So we'll have the patient close your eyes, and we're checking the olfactory nerve for smell. Cranial nerve number 1. Tell me what you smell there, please.
Alcohol.
All right. Of course, in the clinical setting, we would check both nostrils. Cranial nerve number 1 is intact. Cranial nerve number 2 is the optic nerve. We can use the pocket Snellen eye chart for this, or we can just have the patient cover one eye and hold your fingers up. How many fingers am I holding up?
3.
Thank you. You can do that for both sides. That's checking the optic nerve, cranial nerve number 2. Next one we're going to check 3 at one time. We're going to check cranial nerves 3, 4, and 6 for the oculomotor, trochlear, and abducens. Here we can check extraocular movements. Have the patient focus on your finger. We can do the H pattern here for this. Okay. Extraocular movements are intact. That's cranial nerve number 3, 4, and 6. We can also check pupil restriction. That's cranial nerve number 3 as well. Yeah, just check pupil restriction. Good. Cranial nerve number 3 is intact. Okay, the next one we're going to check is the trigeminal nerve, which is responsible for mastication, also sensation on the face. Have the patient close their eyes. You take like a Q-tip like this here. All right, tell me which part of your face I'm touching, please.
Chin.
Okay.
Cheek.
Which
left
one?
cheek.
Okay, good.
Right
Thank
cheek.
you. That's cranial nerve number. Whoops. Cranial nerve 5 with the trigeminal nerve. That's what we're going to check is the facial nerve, which is responsible for facial expression. So I have the patient smile and frown and eyebrows up and down for me. Perfect. That's cranial nerve number 7 of the facial nerve. The next one we're going to check is the cranial nerve number 8, or the vestibulocochlear nerve, which is responsible for hearing and balance. So we can check this a few ways. We have the tuning fork here. We can perform the Rene test, the Weber test, or the Robert test to check hearing and balance. We're not going to actually do those. Check out my last video to see those. Next cranial nerves we're going to check is the 9 and 10, the glossopharyngeal and the vagus nerve, which is responsible for swallowing and the gag reflex, respectively. We could also do another way. We could look into the patient's mouth with the light source here. Say open. Thank you. And say ah. All right. See the uvula rise and fall symmetrically. And then we can also check the patient's gag reflex as well. Cranial nerve number 11 is the spinal accessories. So head movements and shoulder movements. So have the patient look left and right, please. Left and right with your head.
Oh.
Left and right, up and down. All right. We can do this against resistance, please. All right. Good. Down and up. Okay. And have the patient shrug their shoulders. Thank you. And against resistance. All right. And the last one is cranial nerve 12, or the hypoglossal nerve, which is responsible for tongue movements. So have the patient stick their tongue out and up and down, left to right. Perfect. Thank you very much. Next thing we're going to do is check the tendon reflexes. We're going to need a reflex hammer for this. So the first one we're going to check is the biceps here. Have to make sure the patient's arm is relaxed here. Hit your thumb. Good. Next thing we're going to do is check the triceps. We go behind the patient for this one. 45-ish degree angle. Make sure the patient's arm is relaxed. Boom. Next one we're going to check is the brachioradialis. All right. Relax. Good. Next thing we're going to check is the patellar here. Make sure the patient's leg is dangling, not touching the floor. Okay, good. And now we're going to check the Achilles tendon, which is back here. I can't see this too much in the video, but make sure the patient's leg is relaxed right here. Boom. And then we're going to check the plantar. We can use the other side of the hammer for this. We're just going to go from the heel up to like the ball of the big toe here. Okay, so the patient should have no reaction, or their toes can curl. The toes should not flare out. That's Babinski's reflex. That's not normal in adults. It's for children, it's okay. Okay, that completes that portion. The next portion we're going to do is check the musculoskeletal system. So we're going to have to assess the patient's gait. So have the patient stand up, help the patient stand up, and go ahead and walk towards the wall over there for me. Please, thank you. All right, and turn around. And now we're going to go heel to toe, walk towards me. Good. Heel to toe, and turn around again. And then we're going to tiptoe. Good. And turn around again. And walk towards me, please. And walk back without turning around for me. That's good. Perfect. And you go and have a seat for me here, please, Ms. Charles. Thank you very much. All right, so now we're going to inspect the hands and the wrist. Hands on the wrist here. Go ahead and put your hands out here like this for me. Here we're looking for any lesions, visible lesions or deformities. Go ahead and rotate like this for me. Good. No these deformities. Go ahead and turn back around for me. So now we're gonna have the patient hands up like this for me. Do internal, external rotation. Good, good. Now put your hand like this for me. We're gonna check flexion. We're gonna have the patient put her palms down. Good, and back like this for me, and against resistance. Good, and now we're gonna check extension. So palms up. Good, palms. Okay, good, and against resistance for me. Good. All right. Now we're gonna check abduction, which is internal rotation, and then I'll keep your elbow straight. Never mind. Okay. And then, okay. That's adduction. Abduction. Okay, so we're gonna do a couple special tests here. These are both tests for carpal tunnel syndrome. So the first one we're gonna do is Fallon's test. I like to remember Fallon P for prayer. This is actually an inverted prayer, like this. So we're gonna have the patient do this. Okay, and hold that position for me. So in the clinical setting, the patient would do that for 60 seconds, and there should be no tenderness, pain, or tingling. All right, that's good. That's Fallon's test. The next test we're going to do... the next test we're going to do is Tinel's test. Yes, T for tap. So we're going to tap the median nerve here, right here. So we're going to just tap here. Okay. And then, of course, the median nerve is responsible for the sensation in the first 3 digits. So 1, the thumb, the index, the middle, and half of the 4th digit here. So this portion would have either pain, numbness, or tingling. It should have none of the above. Okay, so that's the specialty test there. All right, so the next thing we're going to do is palpation now. So let me see. We're going to do just one hand and wrist for now, but obviously in reality we would do 2. We're going to check the brachial or the radial and ulnar heads here. We're going to take a look, just check the knuckles, check the fingers, do some capillary refill. Check here. Any pain or discomfort, numbness, tingling anywhere in your hands. Okay, of course, we check both hands. Okay, and to wrap things up, we let the patient know that there was no abnormal examination findings. We can always educate our patient as well. We can educate the patient, say about risk factors for osteoporosis. Let the patient know that the bone mass in male and females peaks in our 30s and it slowly declines after that. So specific risk factors for developing osteoporosis include a family history, being a female, postmenopausal, specifically having low estrogen as a female, having low testosterone as a male, excessive alcohol intake, nicotine, and of course a general lack of vitamin D or calcium in the diet. Okay? Any questions or concerns for me, ma'am?
No.
All righty, Miss Charles. I'll see you at our next visit. You have a blessed night.
Thank you.
You're welcome. Have a good night. Until next time. Bye-bye.